Okay, good afternoon, everyone. Let's have absolute silence, please. All right, welcome to the second session of the 5th Annual Bahrain Bayan School Career Awareness Week. This afternoon, we're hosting an exciting panel discussion about practices in the medical field with 3 of our Bayani alumni. Our first panelist is Fatima Sajjad, who graduated in 2007. She has a bachelor's in medicine, surgery, and oncology from the RCSI Medical University of Bahrain. In 2015, she completed her master's degree in cancer at the University College of London. She currently works at the Medical Oncology at Bahrain Oncology Center in King Hamad University Hospital. Our second panelist is Dr. Ali Madan, who graduated in 2013. He studied dentistry at Ras Al Khaimah Medical and Health Science University in the United Arab Emirates. He currently works as a general practice dentist at Unicare Dental and Medical Center. And finally, our third panelist is Dr. Maryam Haji, who graduated in 2014. She studied bachelor's in medicine, surgery, and gynecology from RCSI Medical University of Bahrain. In 2022, she received a master's degree from Queen Mary University of London in sports and exercise medicine. She currently works as medical doctor at Al-Mansouri Medical. Please help me welcome to the stage our 3 wonderful alumni. Welcome, doctors. So, before we start, let me ask you about how it feels being back in Bayan School today. Being that Bayan School is a completely different premises now. Yeah. Dr. Ali.
A lot of things has changed. I was just telling them the last time I've been in school, we didn't have a grass soccer field, we didn't have a paddle field. So you guys are very lucky. Yeah.
We're spoiling these kids.
Yeah.
Maryam, how does it feel being here?
It feels amazing, to be honest. Reminiscing and I'm feeling nostalgic, and it feels amazing to be back, to be honest.
Great. And Dr. Fatima?
Yeah, very nice, very nice. It's nice to see all the changes. It's nice to see some things are the same, some faculty are the same, but overall everything is progressing and becoming better. It's good.
Great. So the 3 of you decided to go into the medical field. Tell us why you decided to do that. Feel free to start, whoever wants to start.
So I think for myself, it was basically I just wanted to do something where I could help people. And I was between actually psychology, being a lawyer, and medicine. And it just, I still remember there were a few of our colleagues who graduated 2 years ago. There was not a career week, but something similar, like alumni came and they were talking to us about it. And I just felt like this, suits me. This is something I feel I can try and see if it works for me. And alhamdulillah, it worked out. It's a difficult field, but it's a good field to be in.
Thank you. Dr. Maryam.
For me, to be honest, it's a funny story. I decided to go into medicine because of Grey's Anatomy. I was really obsessed with Grey's Anatomy, but to be honest, it's not like what it is in Grey's Anatomy. So, but it's something I don't see myself doing anything else, even though my family is so business oriented. So being in this medical field was like going out of the norm. But to be honest, it's an amazing field, and it's very difficult and with a lot of sacrifices, but it's worth it.
Great, thank you. Dr. Ali.
Yeah, so I was also just telling them that since I was a little kid, I actually wanted to become a medical doctor. I wanted to become a physician. And when I reached grade 12, I sat with a cousin of mine who was a dentist. And because dentistry has a lot of handwork, he actually recommended me to take a look at dentistry because I had a phobia from dentists myself. And I wasn't even thinking about dentistry back then. So I took a look at the procedures. I shadowed him in the clinics, and I loved the way that he works. Back then, he had a case of a patient with a front broken tooth, and it's nice to see the patients happy after regaining the smile back. So this has driven me to become a dentist, and I instantly changed my direction towards dentistry then. Alhamdulillah, things are going well.
So no regrets, I'm assuming, the three of you.
No.
No regrets. Great.
Sometimes.
Sometimes?
Not yet.
Right, so we all know that the medicine field has many different paths. So if we can just go around, talk about your different roles and responsibilities in your current jobs today.
So I'm working in the cancer center. So basically we deal with cancer patients, adults, and on a day-to-day basis, basically we see the patients, we follow their blood tests, we examine them, we check their bodies, we ask how they're feeling, if there's any issues they have. Unfortunately, a lot of them have pain, they're not eating well, and then we try to sit down and we figure out what we can do to make them feel better. And basically cancer care as well. There's different parts to it. I'll keep it simple, chemotherapy and other treatments. We decide if a patient should or should not take it. But yeah, essentially it's all about just seeing what the patient needs, seeing what they're complaining of, and trying to fix the issue. That's day to day, I would say.
For me, after doing med school, I wanted to enter the family medicine program, but it was not open. So instead of just waiting around, I decided to do my master's in sports and exercise medicine. And if anyone knows me, they know how obsessed I am with sports. So it was something that was like following my passion and my hobby at the same time. And currently, I work in a medical center that was a dentist clinic, but they just opened the medical center to it. So I'm the doctor there, and people come for consultations and stuff.
Yeah, so in my case, first of all, we start with the emergencies. So say, for example, a patient has some dental pain or has a broken tooth or has some types of discomfort. We'd start with these first and then go on with the other procedures such as the simple scaling and polishing, which is the cleaning, and the aesthetically cases, we'd keep them last. So we'd start with the priorities and then go down. Yeah.
Madam, I'm very interested to know, what is medical in terms of exercise? So you're just dealing with things like muscles, pain. What is it? Can you tell us more about your field?
So basically, it's not a specialization yet, it's just a master's. So what we focused on mostly is diagnosis. And my course had not only medical doctors, we're also physiotherapists, osteopaths, and podiatrists. So it was like a group kind of like learning. And so basically what we do is we look at any injuries, and we work as a multidisciplinary team in MDT to come up with a diagnosis and a rehabilitation program for the injured players.
So
Or
maybe one day you'll become Ronaldo's doctor, you never know.
Maybe.
Get the signatures in today, guys. Right, if we can just go on to talking about being a doctor. Now, especially in your field, oncology is a very sad field. It's where you are literally talking to patients and you never know, the next day they might be gone. So if we can just look at some exciting events that happen in the field of medical, then we can talk about the challenges later on. Tell us some exciting events that's happened in your field, and it's just kind of still in your head, and that keeps you going on a daily basis. Dr. Fatima.
So basically, cancer care, when I went to university, and even just now, which was like 6-7 years ago, has changed drastically. You know, before when someone would have a diagnosis, it was, okay, it's the end of the world. It's, you know, unfortunately, maybe they have like a few months or 6 months or 1 year, but now, with so many developments in this field specifically, I'm sure you guys have seen, everyone is fundraising for breast cancer, prostate cancer, red ribbon, green ribbon, pink ribbon. And that money is actually going somewhere. You know, there is a lot of research going on in the field. So we see over the years where, there is a new medication that's developed, and then we start using it and it works. And you see that same person 3 months, 6 months, 2 years down the line, where previously they would not have made it. So that's what basically keeps us going. the hope that there is a future and there are future treatments that can help these patients.
Very true. Dr. Maryam.
Yeah, and like adding on to what she was saying, basically being a part of making a difference, especially being graduating during COVID times. We saw how things evolved drastically, especially in the world of medicine. And just being a part of, for example, the CPR team and being able to do CPR and then seeing that the patient is alive again. So it's just these small moments that really make a huge difference and that never leave your memory.
Definitely.
So most of the things that we were taught back in university has changed now. So, for example, most of the filling materials that we've been using back in college, there are newer brands, things that are more scientifically proven to relieve pain, to build the tooth better, to more aesthetic products that we're using right now. On yearly basis, there are a lot of studies that are being brought out to the public with the new techniques that we've been using in dentistry. So whoever is going to become a dentist or a medical doctor, you guys have to keep up with these studies, because if the studies is out there but you don't know about it, I mean, it's no use of it. So a lot of things has changed in my opinion, yeah.
And I guess just like you guys seeing in the medical field, we've seen it in the education field as well. There's a lot of advancement in technology across all the fields in the world. What's the implications does it have in terms of your specific roles? Like I know in dentistry, I'm sure there's few advancements where you've benefited from that, especially with the corona.
Yeah.
Do you know of any case that you can talk about?
So there is a new branch, this might be a bit more technical, but there is a new branch of dentistry that's called biomimetics, which is basically copying nature. So in this branch of dentistry, we reduce the amount of drilling needed, and we don't need to be very invasive in our treatments. So this is just a new branch that's coming out. It's being led by a doctor. He's called Dr. Pascal Manier. And this new innovation or innovative branch of dentistry is going to change the world of dentistry. It's going to be, I see dentistry within the next 20 years, a lot of things will be different. You won't be hearing a lot of drilling sounds. You won't be feeling a lot of pain.
That's great.
Yeah, it's getting less and less invasive.
Great. Maryam.
To be honest, in my aspect of things, because I'm new back to Bahrain, I was in London for a year.
Yes.
So things there were a bit different, especially when you look at sports. So basically, the things they would focus on mostly is if just not to spread COVID in any way or any kind of diseases like droplets and stuff like that. So basically, in the sports aspect, it didn't change as much. It's just being cautious about not spreading it as much as I would say in her field, for example.
For us, I would say telemedicine. So basically, before, I'm sure you guys have all experienced it, you go to a doctor's clinic, you wait 2, 3, 4 hours. Because of COVID, we've pushed, now less, but especially during COVID, we've pushed to do things more remotely. So try to have people on the phone, video calls, have people send pictures in if they have something like a rash or like a swelling or something, rather than having to come to the hospital and wait for however many hours just to be seen, and then someone writes a medicine and sends them home. So it helps, because your quality of life is very important. If you're spending 12 hours a week in the hospital, which you could spend at home if you can just make a phone call. So now I feel people are realizing that this is the future forward.
I mean, all the advancements we're hearing hopefully will be the benefit of our future.
Inshallah.
So we just spoke about the exciting things of work. Now, every job has its excitement and it has its challenges. What are the biggest challenges you guys have faced in your medical careers?
So I'll start first.
Go on.
So the dentistry is physically taxing. I mean, people that go into dentistry, and I have to be very honest about it, you'll be concentrating in a tooth inside a patient's mouth. You have to Very focused on the details that you're working on, and sometimes you'll be bending your back, bending your shoulders, bending your neck, and you'd see a lot of the old school dentists, the dentists that have 20 or 30 years of experience with a lot of back pain. There are a lot of appliances that dentists now are using to reduce the strain on the back and strain on the spine. But I'm starting to feel it right now. يعني I'm starting to feel I'm a bit 40 ولا 42. The second thing is the stress, the psychological aspect of it. If you keep on, like if you're working on a root canal treatment and you have to fill a tooth up to 15 millimeter, if you're 2 millimeters short, the patient will come back with pain, the patient will come back with complications, and you're speaking about a millimeter or 2 millimeter short. So you get used to it later on. And when I started working, it was a bit more heavy, but you get used to it, you get better, and the more you practice, the more you improve.
Yeah, we know all dentists nearly suffer from backache. So you spend your money in physiotherapy.
Yeah.
Dr. Maryam.
Starting with the challenges, the biggest challenge is studying medicine, to be honest. It's completely different than school. Going into university, you are responsible for your own time, your own schedules. No one's going to run after you and tell you to do specific things or have deadlines moved because you have a close relation with a teacher, for example. So all that does not exist in university. You have a certain deadline and you have to get it done. And it's just a lot of material that you have to get over and in such a short period of time. So time management is the biggest factor in medicine. So studying medicine is a challenge itself. And then after it is deciding what you want to specialize in is another challenge as well. Because not all medicine is the same. For example, surgery lifestyle is different than following the medical lifestyle. So just knowing what you want to spend your rest of your life doing is a challenge in it itself. So basically, yeah.
And remember, you're making these decisions at a very young age. So
Yeah.
currently our grade 12s
Exactly.
have made those decisions about being a doctor in the future or engineer.
Yeah,
Yes, and lifetime commitment.
definitely.
Dr. Fatima.
So I would probably say the sacrifices. So you have to, like he said, physical, emotional, psychological sacrifices. To be honest, any field done correctly can be really hard, okay? Medicine, engineering, art, anything you put your full heart and time and energy and your parents' money into, it will be tiring and taxing, but the rewards are always there. But you just have to weigh the risk and the benefit, see, is this for me? And also, maybe they wouldn't encourage this, but it's okay to try something and it doesn't work out. Because I remember in my class, there were 150 people who started out.
Yeah.
And 45 of us graduated.
Yeah.
So there's no harm in starting something and then saying, okay, this is not for me. It's not a failure. It's just realizing what you can and cannot do. And then you find something you're better suited to do. So you're young,
I guess on that note, this is why we're having this Career Awareness Week in school, to get people professional like you being on stage, talking to the students, to kind of give them that advice that they need.
Yeah.
Which takes me to my next question. Now, when I did ask you guys, does anyone regret being a doctor? You all kind of looked at me and said, no, we don't regret. But if you were to go back to school, go back to grade 8, to go back to being a senior, what would you do differently?
Less procrastinating.
Okay, which everyone's doing
Ms.
this.
Rasoon and Mr. Midhat, they both know me. They both taught me, and they know that I was the biggest procrastinator there is.
But I always believed in you. I always knew you were going to be that dentist.
Yeah, but alhamdulillah, things worked well. If you feel that you need a push in school, and I'd say start early. If you're procrastinating in school, you're just going to make your life more difficult in college. So start working hard. I think also there is this cap. They have to be, I think, 90% or get a 90%, you have to become an A student to get into medicine or into dentistry. So you have to push yourself hard, and whenever you go to college, you'll feel that things are much easier, And not because I have graduated from Bayan School, but I see that Bayan School is one of the strongest schools there is in Bahrain. يعني honestly speaking, even the underachievers in my class, they became something, or they reached their goals in some way. And even in college, because I took IB biology, I took IB psychology, I took all of the subjects that I required. When I reached college, I felt more prepared. يعني for مثلا biochemistry, I barely studied anything because I knew all of the information from Miss Susan's class. So is يعني psychology. Miss Wusun, ما شاء الله عليها, she taught us everything. When I went to psychology, the Sigmund Freud studies, all of the
You still remember those, huh?
yeah, والله يعني all of the studies that we were taught in IB psychology, all were brought up in uni. So yeah.
So again, you're actually advising them today that the course selections you guys will need to do eventually when you go to high school is very crucial for the medical world.
Yes, yeah.
Okay. Dr. Maryam.
And basically what we're doing here, like ask around as much as you can. Ask doctors, ask engineers, ask pilots, ask all these different specialties, their experiences and what they regret and what they don't regret. Because to be honest, I didn't do that and I feel like I could have been more aware about what I was going into before actually going into medicine. And because I didn't, I felt like I was going with the flow at some point until I decided for myself that, okay, this is my path and I'm actually willing to do this. But some people might not have that in them, so it's just a matter of passing around and sharing experiences.
Great, thank you.
I'm just going to elaborate on, I completely agree with Maryam. Because for myself, I didn't have any doctors in my family. So a lot of people in my class, their fathers, their mothers, and so their fathers and mothers set a plan for them. So I would say specifically for the medical field, you really need to speak to someone who is, you know, who's done it, who's gone through university, post-grad, and the training and everything, and just get things in line. Even as soon as you start, you know, medical school, start planning what's your next step. Because time is going to pass by so fast and you're going to regret not doing all the things that you should have done earlier on. And it's so easy to waste time. It's so easy for years to be lost. And there's nothing wrong with that, of course. But if you're one of those people who, you know, wants to finish and specialize and, you know, just finish the bulk of your studying, you have to be a bit more proactive in understanding what kind of route you want. On the other hand, if you're fine with time, you feel like I'm okay with, you know, taking things step by step, there's no harm in that. But always speak to, you know, specialists in the field so you can understand how things are. Not just like, you know, Grey's Anatomy style. And it's always nice to, you know, see real life.
I believe it's the doctor's responsibility. Like if you're going to ask a doctor, preferably someone that's a family member. If you don't have one, go to a doctor that you trust. Because it's very easy for the doctor or for us to sit in front of you guys and paint that everything is good and well and don't bring out the negative parts of becoming a dentist or becoming a medical doctor. So when you graduate and you'll be in this shock that, well, nobody told me before that it's going to be this way. So I think it's on the doctor's responsibility as well to bring out the...
Definitely.
And you can also arrange to, like, for example, shadow a doctor over summer for like 1 or 2 weeks. Maybe you feel like you're too young, but still, you know, there's no harm. 1 or 2 weeks, few hours a day, just see how things are. And when you work with someone for a few days, they'll start to tell you, you know, how they felt, how they did, what, you know, their regrets, their path. And then you can feel, okay, is this for me? Is this not for me?
Which takes me to my next question, actually. So I'm sure we have some students sitting here who want to be doctors in the future. What kind of advice would you give them today, being doctors on stage, and you have experience now? What kind of advice would you give these grade 8s and grade 12s?
So when you go to university, I'm speaking purely about dentistry. Dentistry mostly is going to be clinical practice because, as I said before, most of the work that you'll be doing is with your own hands. So it's like drawing a circle. If you're not practicing it enough, you're not going to perfect it. So the same thing that I said about school goes for college as well. If you go to college, this will be your only chance to differentiate yourself from other doctors. So the main difference between you and other doctors is the effort that you put in college and the effort that you put in after you graduate through diplomas, memberships, professional certifications. So don't be afraid to take complicated cases under good supervision, and read more about the universities that you're going to. Through the application process, make a good list, apply to the good universities first, and then go down. Because if you're going to a good university, you're going to get good clinical training, you're going to get good theoretical training, and you'll come out as a better dentist. While if you go to a relatively bad university or a university with a bad reputation, you might have issues with the accreditation. A lot of doctors have graduated from non-accredited universities, and they lost 5 years from their lives because the certificate that they got is not accredited. Whenever their bachelor's is accredited, they have to work double the amount of a dentist or a doctor that graduated from a well-reputable university.
So just to conclude, what you're saying there really is to go to a good university, you obviously need to have good grades.
Yeah.
And it really starts from
School.
middle school. So grade 8, put your act together if you want to be medics in the future.
Yeah.
Because everything does count for the future.
Every
Choosing the
single
right
thing that
university, it's all a matter of grade related.
Yes.
Thank you, Dr. Ali. Dr. Maryam.
It's basically being genuine with what you do. Like once you enter medicine and medical field is just about being genuine, like being there for your patients, being there, not just like working and then going back home and forgetting about the patients or patients' needs. It's not that kind of job. It requires constant care, and so you just have to be kind.
Commitment,
Basically, yeah.
definitely.
I would say planning. So plan everything ahead, like I said before. Plan your university. Once you're in university, plan the next step, because there's so many different pathways you can take. I'm sure maybe some of you guys have doctors in your family, some of them trained in the UK, in Australia, and wherever, in Bahrain. So you need to, understand, okay, I can go here, I want to go here. And you have to start doing all of those things earlier on in your first year and your second year of medicine. So you can understand, like he said, about memberships and exams and all those things. If the earlier you do them, the faster you will get into a program. And you also have to remember one thing, that in the medical field, you're never done.
Yeah.
It's not like, another, like for example, just a bachelor's degree and then after 4 years you're done and you work and then that's it. No. There's always exams, there's always studying. If you're 40 or you're 50 or you're 60, there's always things to read up on, advances that you have to be up to date on if you want to be, the best in your field. So if reading and researching is something that you don't really love, maybe this is not the correct field for you.
Yeah,
So you really have to remember that.
Especially research. Like we weren't told before the importance of research until it was a bit too late.
Yeah.
So being enrolled in researches is something I really, really recommend at an early stage. So you start publishing early.
And
I can
even-
argue and say the research is in all fields, in every
Exactly.
career. Whether
Yeah.
you want to do art in the future, you want to do medicine or engineer, research is part of the path to
Definitely,
growth.
yes.
And even if you're applying for jobs later on, and let's speak in a very practical way, if you only have your bachelor's degree, Bahrain is very saturated with doctors and dentists, and we have to be very honest about it. You have to bring in the best CV for you to be accepted in a good hospital. So if you're just coming in with your bachelor's degree, there are 400 doctors that are unemployed with the same qualifications that you do. So you have to do, as Dr. Fatima said and Dr. Maryam, you have to do memberships, you have to go through a lot of CE hours, a lot of training, clinical training. You'll be spending a lot of money, but it's all an investment in yourself. And you're going to get it later on through experience or through landing a good job. So
Very good advice there. Which brings me to my actual next question, which relates to what you were just saying. You have an audience in front of you today, and there are some students here who want to do medicine, and parents like their kids to have that title of being a doctor, dentist.
Yeah.
On a true level, what advice would you give these students today in terms of the medical field? Obviously, GP is very repetitive. We have a lot of doctors sitting at home with no jobs. So what kind of specialities would you recommend these students today to look into so they can research, they can leave here today, go do some reading about it, and decide on a future medical field? Is there anything that you guys would really highly recommend?
I mean,
Oncology.
Oncology?
Yeah.
Do we not have many oncology
No.
doctors? Okay.
My center has, let's say, 20 doctors, and 2 of them are Bahraini.
Wow.
So there's a lack. There's a serious lack
there is a lot
because of the field, you know.
a lot of demand for nurses as well.
Nurses.
A lot of people, they don't want to become the assistant to a doctor. I don't see nursing being that they have their own job, and the things that they do is much more than what a doctor does on the daily basis. So there is no shame for you guys to go into nursing if this is something that if you like, if you have the empathy for it, if you have the power to give more for people, there is no shame to go for nursing as well.
So you're talking about a dental nurse.
No, medical nursing.
Medical
in general,
nurse.
I think.
Okay.
It means, yeah.
Do we have enough dental nurses?
There is a lot of demand.
There's a lot.
Yeah, there is a
Okay.
lot of
So
demand.
if you're
for
interested
medical
in
nursing.
dental nursing, maybe it's not something you should be considering for the
Dental
future?
nursing, يعني?
No?
No. I
Okay,
wouldn't
so
really
more into
recommend
medical nursing.
Medical nursing, yeah.
Okay, very good advice.
I feel like
Dr.
there's a
Maryam.
gap in every specialty, to be honest, like GP as well. But the thing is that you have to enter something that you are passionate about, because you're going to be spending the rest of your life doing this. And it's not like a 9-to-5 job, for example, where you just go to work, you get a few things done, and you're back home and you forget about it. It's more than that. So having a specialty you are passionate about is very important.
Great.
Yeah, that's true.
Final advice for these students who want to do medicine in the future. One advice, one strong advice that they can leave with today and never forget.
Be strong.
Yeah.
Be strong.
If
And,
you want to do it, just go and do it.
Yeah,
Don't let
and I
anyone
know
stop
this
you.
this period of time in your lives is very stressful because you guys believe that the decision that I'm going to take now is going to change my whole life, and I'm going to stick by this decision for the next 40 to 50 years. But as Dr. Fatima said, there is no shame if you want to, like say you get into medicine or you get into dentistry and you don't like it. There is no shame for you to switch to do something that you love. So it's not an irreversible damage. If you take this wrong decision, rather you're going to have a second chance, a third chance, a fourth chance, and a fifth chance. So do your best, think about it, read more about it, ask doctors, even if through Ms. Ghossoon or Mr. Mirhat, if anybody has any questions, I think we'll be more than happy to help you guys.
So I guess everyone's advice here is really do some research
Yeah.
and do what you love.
Yeah.
That's the most important things, I guess.
Yeah.
All right, I'd like now to open the floor to students to ask any questions. Raise your hand. We have the ushers with their mics coming round. We have a question at the front.
Okay, so my question is to Fatima. So you work at the Bahrain Oncology Center. So like you try out treatments and all for cancer, but is there actual research being done in Bahrain to help advance cancer treatment?
Okay, we just to be clear, we follow international guidelines when we treat. We don't try out new treatments in Bahrain. So far, there are no, basically they call them clinical trials, where basically they try new medications that are out on people. They're not done in Bahrain. The first was the COVID one. Other than that, it's not done in the cancer field. There is a lot of research being done with the RCSI University in different fields. Cancer, there are a few studies going on. There's always research going on in different fields, but trying out medications, we don't do that in Bahrain. It's not approved.
Thank you. Any other questions?
At what age should I start considering which field I'm going to be working in?
Which age should I consider the speciality? Yes?
I'd say by grade 10.
So
يعني
grade 10, they decide.
By grade 10, you shouldn't decide by grade 10, but at least know or have an idea about what you're going to do, because in grade 11 and grade 12, you're going to select some subjects and start studying يعني for whatever you're thinking about.
Do you mean the specialty in the medical field or to enter the medical field? Oh, any field, okay, yeah. Probably somewhere around 10th grade. But specializing which one you want to do in medicine is any time.
Yeah.
Anytime. Even later you can change, there's no harm.
But Dr. Ali touched on a very important point. In grade 10, you will have a course selection. So you need to select the right courses to do IB, and that will help you go into the medical world. Yeah? It's too early for you guys in grade 8 to talk about this, but I mean, just for you guys to be familiar with these terminologies. So IB is in grade 11 and 12. It's an international baccalaureate. It's a very prestigious syllabus. It prepares you for the real world of university.
Sorry, I just want to add one thing about the same thing Ms. Khosun was saying. There's different years, programs. So if you take IB and you reach a certain number of points, then you can get a year off for the medical field.
Yes.
I'm sure other fields as well, but you can save a year if you plan early.
So if the university was for 4 years, you can go in with 3 years with IB program.
5 and 6, basically.
For medicine.
Yeah, for
Yeah.
medicine, yeah.
Yes, question?
Do you think we should study and work in Bahrain, or should we go to a different country?
Should we study in Bahrain or a different country?
It depends on what you can and cannot do. I mean, some people, their families don't let them. Some people don't want to leave Bahrain. I don't think there's anything wrong with the university in Bahrain. I graduated from it. Many people graduate from it. It's excellent. It's an international degree. It's an international university. We have a mix of, professors from there, from here. You can do a year abroad if you choose to go to RCSI. The other university, the Arabian Gulf, is also very excellent. I'm pretty sure the majority of doctors that you guys probably go to have graduated from Bahrain. On the other hand, in general, university experience outside Bahrain is very different. It's always nice. You get that independence. You get that different experience that you won't get living at home. But I think that's basically an answer you have to decide for yourself. But education-wise, I mean, the education in Bahrain is pretty good.
For dentistry, you have to study abroad. There are no universities here that provide dentistry as يعني bachelors. You can't really do it here in Bahrain. You have to travel. I did mine in the UAE. Being, as she said, يعني it's a different experience. You have to be independent. You have to pay your own bills. You have to start buying furniture. يعني all of these things make you more independent, and I believe my personality has changed the moment I went to the UAE. Yeah.
I personally had the two experiences. I did 6 years in Bahrain, and to be honest, it was the best decision to stay in Bahrain, especially with the load of medicine. And then the 1 year that I did abroad in the UK is where I learned independency in a way. So you could do something like that, where you can stay in Bahrain and then go abroad, or come to Bahrain, like you could vice versa.
Thank you. One more question.
Hello, this is for everyone. If I didn't take biology or chemistry in school, can I still apply for a medical degree?
It all depends on the university you're trying to apply to. For every university, there are a set of requirements for entry. So I think back then, I think RCSI needed 26 or 28 IB points. You needed to take biology, you need to take chemistry. It all depends on the university you're trying to apply to. If you have something in mind, just go to their website, and there are some entry requirements, and you'd see all of the information presented there. Yeah.
There's foundation courses everywhere,
Yeah.
and if you're planning to go to the US, pre-med, depending on your university, has different requirements. So it doesn't mean that you can't do it. It just might mean that you need to do a little bit of extra work, but you can still do it.
Okay, well, on behalf of the Bahrain Bayan School entire community,
I think
we'd
we
like
have
to thank our doctors.
one more
Do we have another question? Do you want to ask another question? You do, you don't?
How different are the MSATs than the normal SATs?
Sorry, what was the question?
The merit SATs, how different are they than the normal SATs?
SATs?
I just heard SATs. Mustafa, what was the
SATs?
question?
The Emirat SATs, they have different...
The Emirat SATs?
Yes, how different are they than the normal SATs?
How are they different to our SATs? No, SATs are all international.
US only, yeah.
Yeah.
I think
And they're all the
US.
same assessment.
No, but I think for Emirates there's a different one.
We'll check with your counselors and get back to you. I guess one final question there.
My question is, do you recommend RCSI or AGU in terms of easiness?
Is that a question even?
It's like saying, do you recommend Bayan or I cannot?
Exactly.
It's
Nice
all
one.
it all depends what you want to do. Visit both the campuses, talk to people who went to both universities. They both have very good education. AGU is going to have a new campus, inshallah, soon. So maybe their campus will be better than RCSI. It's a very difficult question to answer. But for me, obviously, I loved my experience in RCSI. I would not change it.
You're asking the wrong people.
I think
Simple.
it depends. Like the culture in RCSI is different than it is in AGU. So it depends on what you prefer.
Definitely.
See both places,
Yeah.
visit, and then you can decide.
But we say RCSI.
I'll look around for any final questions.
Oh.
Again, due to time, I can only take one question, guys. So just one. Mike, please. Thank you.
Does it matter, like, if our goal is to come back to Bahrain and work here, does it matter if we, does it become harder for us to work here in Bahrain if we study outside or no?
No,
It's all the same?
no. Sometimes it's better.
Like
In what
outside of
way?
Bahrain?
Yeah, because it's an international
Experience.
degree, you know? So, but yeah, it doesn't matter.
I did say that was a final question, but he looks desperate. Let him ask the question. Sorry, panelists.
Miss, at what age is a medical drug allowed?
What age?
نفس الميديسن At what age is a medical drug allowed? يعني
What do you mean? Which drug? Panadol? You can have Panadol now.
not Panadol, like the drug that you use for
All right, guys, just to answer that question, you need to go back to your doctors to find out what age you can take medicine. All right, I'm going to wrap it up just there then. On behalf of the Bahrain Bayan School entire community, would like to thank our doctors and Bayani alumni, of course, for being with us today. As a token of appreciation, may I please ask Mr. Midhat to come up? Doctors, we know you have a very busy life and we appreciate you being here with us today. Thank you very much. Thank you very much, ladies. Thank you. We'll just take one quick picture together. Thank you, audience.